and thank you for tuning in today. You are watching The Dietitian on a Mission. My name is Janet Calderwood. I'm a registered dietitian. Pleased to be your host of the show today. I want to welcome you. Today we are going to have an exercise class with my dear friend Matt Laporte. He is a doctor of physical therapy, and we know that many people like you that are watching today have some difficulty exercising, maybe have a lot of pain and some physical chronic disease conditions, and Matt is going to help us, right?
Absolutely.
You're going to help us learn more about the do's and don'ts of exercise, maybe some specific strategies for different types of people. And I know you mentioned something about like chair exercises, balance, and things like that. What can people expect to learn from today's show?
Sure. So it's about no matter where you're starting from in terms of fitness level, it doesn't matter where you are, you can always move more. Right? We don't move enough as a society, so it doesn't matter your current fitness level, whether you have been sedentary for years or whether you're an elite athlete, we can all move more. So it's going to be about tailoring each exercise to each specific person.
Okay, that's good to know. And I am going to be the student today, so I'm going to be taking the lead from Dr. Matt, and he's going to help me. I would just like you to remind people how important safety is when they're tackling any type of exercise routine. I mean, what should they be aware of?
Sure. So before we start any exercise program, we want to make sure you visit with your doctor, make sure everything's up to snuff, make sure you're in good shape, cardiovascular system, everything's ready to start an exercise program. We want to make sure that's in place before we initiate any type of exercise program, because a lot of people haven't moved in years. So we want to make sure that you're in good shape to be able to participate in a fitness program.
But some of the things that we're going to be doing today, do you feel that they would only be hurting themselves by not doing that? I mean, we're going to be doing some low things, right? Some
right. So, and they can even follow along with us as we do them. I think that would be great.
Isn't that a great suggestion? Follow along with us. The best way to learn is to be able to demonstrate the learning. If you're in the convenience of your home today watching the show, you can get a chair, make it available, because I and you as well can learn how to do things the proper way. And that's important, isn't it, Matt? Doing things correctly?
Absolutely, to do the exercises properly. And it's also just about empowering people to show them that they can exercise and they can move more than they currently are. Even if they're in chronic pain, they can still exercise and move more than they are.
All right, so where do we start?
I think what I'd like to start with is chair exercises. A lot of people haven't exercised a lot in their life. A lot of people are in chronic pain. So showing people that a chair exercise is just as effective as any other exercise.
Now, is this something that people could do if they're in a wheelchair?
Absolutely.
Or?
It doesn't matter whether they haven't exercised at all, whether they're in a wheelchair, they can still perform exercises.
Even from their bed, probably.
From their bed, absolutely. It doesn't matter what state they're in, what fitness level they're at. I really want to empower people that they can move no matter what state they're in.
Okay, move more.
Move more is the key.
Move more, move more. Okay, well, let's do it.
All right, so I'm going to have you take a seat. We'll go ahead and start with some chair level exercises.
Right.
So we're going to start down at the feet. So we're going to start with gentle ankle pumps, just moving the feet up and down. So
now,
this is...
Okay, I'm sorry, go ahead.
So this is really important. A lot of people that have chronic swelling in the legs, the muscles act as a pump. So when we move our ankles, our muscles are contracting, acting as a pump to pump that fluid back up. So people with chronic swelling in the legs, this is a great exercise.
Lower leg edema.
Exactly.
And things like this. How effective is this?
Extremely effective. You know, it's effective because it's easy to do, right? We can do it while we're watching TV. We can do it during commercials.
Yes.
To pump that fluid back up.
Don't do it when you're driving.
Don't do it when you're driving.
Okay.
But when we're sitting, gravity pulls that fluid down.
I see
right?
that.
And it pulls in our legs. So when we contract those muscles, the contraction of the muscles helps bring that fluid back up.
Okay, and then do you have, like, for starters, you have any certain amount of these back and forth?
For this is a kind of a simple exercise, so I like to time anywhere from 20 to 30 seconds of ankle pumps. I think is perfect.
Ankle pumps, I like that.
An easier way, during the commercial. When the commercial starts, I do my ankle pumps. When my show starts again, I can take a break.
Okay.
So rather than concentrate on the amount of time or amount of reps, do it during commercials.
So since you're watching this show, and this is a 28-minute show, and we don't have any commercials, you can do it for 28 minutes straight, okay? I'm just kidding. That was a joke.
But to
okay.
your point with that, it's also about easing into exercises, right? If we haven't exercised in 10 years, then we want to slowly incorporate exercise into our daily life.
Yes, that's what we want to do.
Okay?
You know, even if people are brushing their teeth and they have a chair by the sink, they could be doing their ankle pumps.
Exactly. We
the
can do
same
them throughout the day. We don't have to have one specific time of day that we're doing it. We can do it throughout the day in
Okay.
an exercise program. I'm going to have you move up. We're going to work on the quads next.
Quads, okay.
These are really important. A lot of people that have weak quads have trouble when they stand. They have knee buckling, a lot of different issues. It can also give a lot of knee strain if we
Okay.
don't have strong quads.
Okay, I have a question.
Sure.
Now, when we're sitting in the chair, is my back supposed to be against the back of the chair?
That's a great question. So we want
Okay.
to sit forward.
Sit forward.
We want to have our belly button pulled in nice and tight because what that's doing is incorporating our core muscles. It's the
Okay.
muscles that surround our trunk and stabilize our spine.
I feel like I'm back in the military, okay?
And most people have weak core muscles.
Okay.
Okay, so it's really important, just like you are, we're away from the back of the chair, where belly button is pulled in nice and tight, and then we perform the exercises.
Okay.
Okay? So we're going to do what we call long out quads. We're going to kick out. At the top, we're going to really focus on tightening that quad.
Now, what about the foot? Is it...
Foot, I want your toes pulled back.
Okay, that's
Okay.
quite a stretch there.
We're going to do nice and slow up and nice and slow down. A lot
Okay.
of people, you'll see, will do it fast.
Yeah, I've seen people
Right?
do that.
But that doesn't really hit the muscle.
Okay.
Nice and slow up.
Slow
At
up.
the top, we're going to pause nice and tight to that quad. Toes
Mm-hmm.
are pulled back and back down.
And gee, that's...
Okay? We'll
I'm
switch.
gonna
We'll do
be
the right side.
I'm probably going to be sore
Nice
tomorrow.
and tight. And again, the key is slow.
Slow
up, slow
and
down.
steady.
Slow and steady. We don't want to use momentum to get it up
Okay.
there. We want to use the muscle that we're
Use the
working to get it
muscle.
up there.
Okay.
Next, we're going to come up to the hips. So we're kind of working from the ground up.
Ground
from
up.
our foundation up. We're going to work at the hips next. We're going to do marching back and forth.
Marching.
Yep.
Okay, now wait a minute. With the quad exercise we were just doing, how many of those do you want us to do normally?
So a good amount of reps is anywhere from 10 to 12
Oh,
is what I
okay.
tell people. So we'll shoot for 10 to 12 on those.
Okay,
And now we're back out to the hips. We're doing our marching.
marching.
Again, just like you are, we're away from the back of the chair. Our stomach is nice and tight, pulling our belly button in, but also we want to make
Breathe.
sure we're breathing. Exactly.
See, I was getting
So a
short
lot of
breath
people,
there.
when they're doing exercises, want to hold their breath. It's really important that we're breathing in through the nose and out through the mouth.
in through the nose, out through,
Through the mouth.
Okay.
When we hold our breath, it increases our blood pressure. So we really want to make sure that we're breathing.
Okay, we want to breathe.
Okay, we can
Because
take a
if
break
we
from
don't
those.
breathe, we won't get to the end of the show.
Exactly, we'll never make it.
We'll never make it. Okay.
Next, I want to move up and we're going to work the abs next.
Okay, the abs are next.
The abs are
Okay.
next. I'm going to have you hold the chair
Hold the chair.
and we're going to do both legs up and down.
Oh, this one's tough.
If it's too tough for both, we're going to do one at a time.
Oh,
And to challenge you, you're going to bring the foot out more this way.
have you been practicing these? These are a little on the tricky side.
Okay, so
But
that's
wait a minute, I feel it more in my leg.
so you're going to have the muscles that are lifting here, so we can scoot out a little bit and lean back a little bit.
Okay.
Contract your stomach, good.
Okay, I can.
Now if we can see if we can try both and pull them in.
Oh, that's tough.
All right, so that's really targeting those abs. Okay, let's take a break. Good.
Oh,
So again, anytime we start to strain, we're going to want to hold our breath. We want to make sure that we're breathing.
like I just did.
Right? We'll turn bright red, but we want to make sure we're breathing.
Okay.
All right?
Now, can you show me again? I want to make sure that I get this. I'm supposed to lean on a chair.
So we're going to hold here nice and so we get some
Don't
support.
fall off the chair.
Don't fall off the chair. We're going to lean back just slightly so we're not touching the back, and then we're just going to bring them in and out.
In and out.
All right? If it's too challenging, we're going to just do one at a time.
I think one at a time for me.
Okay?
Okay.
And we can
good.
even alternate. We can do left and right, alternating.
You could do that. And don't forget to breathe.
And don't forget to breathe. So each
I can
exercise,
feel that.
yeah,
And you should be able to
you
feel
should be able to
something.
feel it.
If you're not, maybe just adjust something somewhere.
Just adjust.
If you're doing these at home, you probably feel it too, don't you? I bet you do. Okay.
So it's good that we have a bottle of water or something with us too to stay hydrated through the exercises.
Okay.
That we're breathing, that we take a rest break when we need to.
Take a rest break when you need to. Okay. What
Okay.
else?
So I want to work on trunk mobility, okay? So we do a lot of things in one plane. So we walk forward.
Yes.
We don't do a lot of this motion. So I'm going to have you,
Turning.
right, so I'm going to have you cross over,
Okay.
and we're going to just rotate, work on that mobility. A lot of
Yeah.
people that go out to the golf course, they want to improve their golf swing. This is a great warm-up exercise to do just to loosen up those hips and that spine for that rotation during the golf swing.
Would you say that this is a good thing for people to do to reduce injuries?
Absolutely. So
yeah.
we're loosening up those muscles, we're loosening up the hips, we're loosening up the spine.
Uh-huh.
So those muscles are going to be lengthened in a better position so we reduce injury.
And what do you call this exercise?
So this is a trunk rotation.
Okay.
That looks perfect. Again, we're away from the back of the chair just like you are, just rotating left nice and
But you're-
slow and rotating right.
And Matt, you're not like supposed to rotate your whole body. You're just supposed to.
Correct. So your base of support, so your legs are nice and stable.
Okay.
And just your upper body rotating left and right. That's perfect.
Okay, you got that? All right. It's nice to have somebody here to guide you, believe me.
That's perfect.
Okay.
So I want to move up. We're going to work on the neck a little bit. A lot of people have tightness in the neck. We sit at computers, we sit on the couch. We don't have a lot of mobility in terms of neck mobility. So we're going to work on the muscles on the side. I want to stretch those out. I'm going to have you grab the base of the chair,
The base of the chair.
okay? You're going to reach over your head and put it on the side of your head.
Side of your head.
And you're going to pull it opposite that hand that's supporting.
Oh, okay. So I
Okay.
gotcha.
Perfect. The other option is we can put that right hand that you have there, we can put it behind. And then we can do the same
Wait, put
thing.
this one
Put that one
behind.
behind
And do the same thing.
and pull opposite. Our body stays still, it's just our head that's moving to the side.
Oh, okay. Just move your head.
So we're stretching what's called the scalenes. It's the muscles on the side of the neck. That's perfect. So anyone with a lot of neck pain, decreased neck mobility, it's a great exercise to do.
Well, you get a lot of pain in the neck.
Sure do.
And your head's on there, so.
Or you,
and then
you wake up, you've slept wrong. It's a great exercise
so
to
just
kind
do
of
this
loosen
one.
up.
So you are basically grabbing and then.
So what we do, we grab the chair, we put it behind because it keeps our shoulder down as we stretch away from that. So that's why we do that.
Stretch away
Yep.
from that, and then you can
Provide
gently.
a little gently. Yep. And we should
That's
feel
a
a good
nice
stretch.
stretch.
Yep.
Okay.
Any type of stretch we do, we want to hold 15 to 20 seconds. It gives the tissues time to stretch out.
Stretch
Okay.
out. 15 to 20 seconds. Okay.
How you feeling?
I feel like $1 million.
So I wanna talk about a common condition with most people. It's back pain.
It is really a big problem.
It's a huge problem. Statistics show that at any one time, 31 million people have some sort of back pain. And I think we've all had some episode of back pain or know someone that has had back pain.
right.
So it's a big deal. It's a big issue. It's actually the #1 cause of disability worldwide is back pain.
And it's funny because I think that people are turning more and more to a lot of medications.
Right.
And they get addicted to it. It can be really a vicious circle.
Right.
But if there's other modalities that can help alleviate back pain, of course stretching and some of these exercises that you're showing us, then we should give it a try, especially if it brings a lot of relief. Now, I wanted to ask this, and I had forgot to put it on the list, but one of the things I wanted to know, when people do have a lot of back pain and muscle soreness, do you recommend ice packs or do you recommend like a heating pad?
So that's a great question. A lot of people want to know ice and heat, when do I use which one, right? I have an injury, I'm hurting, which one do I use? For acute injuries, so injuries that just happen, where we have a lot of inflammation, so we sprain our ankle, as an example. It's something
Okay.
that just happens, we want to use ice
To reduce.
to reduce the inflammation.
Okay.
Up to about 6 weeks is still about an acute injury. Anything that's chronic, people with arthritis, people that have any type of chronic back issues, heat is great to loosen up the muscles, to provide some relief that way. But if we still have any type of inflammation, irritation, redness, we want to make sure we're using ice because there's already a lot of blood flow to that area and we want to reduce that.
Okay.
The ice is going to help kind of constrict those blood vessels and reduce that inflammation, also help with the pain.
So if you feel it like really, really throbbing.
You got it. That's time for some ice.
Okay.
So any type of acute injury that just happened, ice is your friend.
Ice is your friend.
Ice is your
and
friend.
they have different kinds. Like they have like these ice packs, right? They're like.
There's a lot of different fancy stuff on the market in terms of
Yes.
ice. You can use a bag of peas. Go to the freezer, get a bag of peas,
Therapeutic
put it
green
on. It
peas.
doesn't
Come
have
on.
to be anything fancy.
Okay. Peas. Okay. Gosh, I didn't never know that. Okay.
Works
good to
perfect.
know. All right.
All
I have
right.
a bag of peas. Okay.
You mentioned too with back pain, people taking pain medications, and we're masking the problem, right? We're taking
not
pain,
fixing
we're
it.
not fixing the problem. So we may feel a little bit better for a short period of time, but what is that underlying cause of that back pain we're not addressing? Kind of like a Band-Aid covering the actual issue, but we're not
Okay.
addressing it. People too will ask me, I have back pain, how about a back brace? You know, which back brace do you recommend? And I'm not a big proponent of back braces. What happens is people will use a back brace for an hour or two and it feels better, gives them some support. A few weeks down the road, they're using a back brace half the day because they
gosh.
need it half the day. A few weeks down the road, they need it all the time. They can't even get out of bed without using a back brace. What happens with a back brace is it provides support, but those muscles that we have naturally that stabilize the spine, take a vacation.
Oh.
The back brace is doing the work. I'll see you later.
Yeah.
And those muscles get really weak.
Okay.
So then they need the back brace because they have no more support. Those muscles
Okay.
that their job is to stabilize the spine have really atrophied and gotten weaker. So back braces I don't really recommend.
All right, but a lot of times people go to their physician with these complaints. You know, I've got back pain, I have neck pain, shoulder pain. When is surgery not an option? I mean, almost always. I mean, I don't know if this is true or not, but do you feel that, or you know, that this has to be, like, there are other things that people can do, right? They don't always need surgery.
So surgery is the utmost last resort when you've tried everything else. There's so many conservative treatments that we can use today, going to physical therapy, using modalities to really avoid surgery. Surgery is that utmost last resort. So I encourage
Doesn't
people.
fix everything,
it
does it?
doesn't fix everything, and a lot of people end up even worse off after the
Really?
surgery than if they actually tried some conservative treatment. So I really caution people on jumping right to surgery as
Okay.
a fix.
Okay, and then I wanted to ask you one more quick question before we go on. We have, you know, we're about halfway through the show, but I wanted to know what your personal thought on people that go visit a chiropractor on a regular basis. Is that like a temporary kind of a situation like you were describing the medication, or can that be really beneficial but longer lasting than something like, you know, effective, I guess? Is it very
Sure.
effective?
So I think there's a lot of good chiropractors around, but I really caution people on repeated treatments. If you have to go see a medical professional on a consistent basis, there's something wrong there, right? We want to empower people to be able to give them the education that they need to take care of their bodies and then send them off with that empowered knowledge to be able to take care of themselves.
Okay.
If you have to consistently see a medical professional, there's something going on there
Okay.
that hasn't been addressed.
Okay. So if they're not getting any relief, then maybe they need to look.
If they have to consistently write, if they have to consistently see someone for a certain issue, something is not being addressed. They should be empowered to be able to take care of that issue on their own.
And as you mentioned, I know there are many good chiropractors available, and people that do go see them do report some improvement.
Right,
you know.
and they get that empowerment to how to handle their issue or their injury.
Okay. All right. So what you got for back pain?
So back pain, the biggest thing and cause of back pain is we're not stretching enough.
Oh.
Okay, we sit all the time. There's a muscle, it has a funny name, it's called the psoas muscle. The name doesn't matter, but it's a muscle that goes from the thigh and actually goes in deep to the front of the spine. Okay, so when we're sitting, it's in a shortened position.
Okay.
And we sit all the time, right? We
Yes.
sit on the couch, or we sit in the car. So that muscle, if it's shortened and it's tight, when we go to stand up, it's tugging on our spine, okay? and our back muscles are tight. So what we have is this little tug of war going on when we try and stand up, and you see people stand up and it takes them a few minutes to straighten up because we have this tug of war going on between that psoas muscle and the back muscles.
Okay.
Tightness of both of them, okay? So stretching is really the biggest cause of most back pain. If it's not related to any type of injury or anything like that, stretching is really important. So I want to show you that stretch to that muscle, okay? There's a few ways we can do it. First one I'm going to show you is in a kneeling position. We're going to use this chair here for support. So I would be stretching this psoas on my left here.
So do I do this with the same leg?
It doesn't matter, whichever one you want to do. So we're in a kneeling position. We have something for support. We're going to lunge forward onto that front leg, but our trunk stays up tall. We don't bend forward.
Oh, okay.
So we're going to lunge onto your front knee. Stay up nice and tall with your trunk, and we're looking for a good stretch in the back leg.
Oh, I can feel it.
All right? If we don't feel it, you're going to squeeze your butt muscles, and then you really feel a good stretch. All right?
Yes.
On the front of that thigh. So it's stretching out that muscle, that psoas
can
muscle
feel
I
it.
mentioned. Yep, you should be able to feel it. So we want
Wow.
to make sure that muscle's nice and loose.
And these are good for back?
Great for back pain. So if you can't do it, you could also use a pillow or a cushion if you have trouble kneeling.
Okay.
The other
that's a good
option, if you
idea.
can't kneel at all, would be to do it on a stable chair where you put that foot up
Okay.
and you just lunge forward just like we did.
Just a little. Now, do you bend your knee or anything, or just straight?
So the back knee is going to stay straight. But this is for people that have trouble kneeling directly on the
Oh,
knee if they've
okay.
had like a knee replacement or just a lot of arthritis that they're not
Okay.
able to kneel.
All
Okay?
right.
The next one, we'll take a seat. It's another common muscle. It's a muscle that goes from the hip around the back to the tailbone.
Okay.
It causes a lot of sciatic issues for a lot of people. It causes a lot of low back pain. We're going to take one foot, we're going to put it on the other side.
Yes.
You're going to take your right hand, put it on the right knee.
Yes.
Your left hand's going to stabilize your foot here, and we're going to gently push down on that knee.
Oh,
Okay? To increase the stretch, we can lean forward just a little bit,
it's a good one.
and you should be able to feel it in the hip and the low back area.
You could feel it.
Yep. Common issue.
Can you feel it?
So we're going to hold. Any type of stretch you want to hold. What it does is it allows the tissues time to stretch out. So anywhere from 15 to 30 seconds is perfect to a
Okay.
hold. And then we would repeat on the other side. Again, the foot goes up onto the opposite leg. We would gently push down on the knee. So obviously anyone that's had any hip replacement, any type of hip issues would want to avoid this exercise.
Okay.
But anyone else that has no problems with their hips, has healthy hips, this is a great exercise for low back pain.
Now, do you have, I know this show is going by so fast. We have about, 5 minutes. Can you kind of review some of the balance things that you have
So
for
balance
us?
is huge, right? Statistics show that every 11 seconds someone falls
Wow.
and is in the emergency room for a fall, and every 19 minutes someone dies from a fall.
Really?
So this is, yes, this is serious.
Okay.
So balance is really paramount. It's really important. Number one cause of falls is environmental, so people have cluttered homes. They have the little dog running around, they got the dog bowls, they have the throw rugs. So really making sure that your environment is clear. You have clear paths, especially at nighttime, the lights are down. You want to make sure that it's not cluttered.
Okay.
The second cause of falls is balance issues. So people with decreased strength, as we get older, we have decreased strength.
Okay.
We have 3 regions in our body. We use our eyes to see where we are in our environment, which helps with our balance. We have the inner ear, which
Okay.
helps with our balance, and we have our proprioception, or our sensory perception in our joints to tell us where we are.
All right.
So we can quickly run through a few balance strategies. We're
Okay.
going to come up to the chair, behind the chair. Always want to make sure that we have something stable to hold on to.
Okay, especially
For-
if you have balance issues.
Especially if you have balance issues. For some people, just this, lifting off from the support and standing, is the start of the balance.
Okay.
Progression, we can work on holding, but doing a single leg stance,
Like stance,
and then without holding on.
without holding on, but having the chair right there.
Having the
if you
chair
need
just
it.
in case. Our aim is for anywhere from 10 to 20 seconds of a
10
single
to
leg
20
stance.
seconds. Okay.
Okay.
Good.
And we will alternate. So this is, we could do this when we're in the kitchen. We can do this while we're brushing our teeth. so we can incorporate all these type of exercises throughout our
If
day.
people have a hard time, like, could they, like, maybe look at something? Does that help?
It
you know?
does. So that's a great point. Focusing on something on the wall
Okay.
really helps with balance.
Okay.
That's perfect.
Okay.
If once they master that one, really just adding something else like leg swings to challenge that balance a little more forward and back,
Okay.
left and right.
And, like, if they need to, they could,
They can hold
certainly
on.
Hold on
Yep.
to the chair.
Exactly. And also we move in a forward plane, so we walk in a forward motion, but a lot of
Okay.
falls happen when we're trying to get out of the way of the dog or whatever, to the side or backwards. So I really encourage people when they're out walking, maybe start walking backwards. Maybe
Really?
trying side to side steps.
Like, just walking.
Side to side.
Hey, you could train your dog to
You could
walk
train your
side to
dog
side.
side to side. But training in different planes rather than just a forward plane, I think is
Okay.
important.
Okay. And then what about as far as balance go? I mean, is there any arm, like, we know that this is like the core area, but as far as, like using your arms to help you balance, I mean, is there anything that they can do as far as their arms,
Sure.
like to catch their fall or whatever?
Right, and even being close to a wall so that if they do start to lose their balance, they can hold on to the wall, but then just reaching to different spots on the wall is great for balance.
reach.
And then if they master that, incorporating the single leg stance and reaching for different spots on the wall, but they're near that wall in case they do start to lose their balance.
Do you find that sometimes their medication needs to be adjusted?
Sure,
with
I mean, there's
sometimes-
so many causes of falls, right? So we have people on blood pressure medications, pain medications, which all affect our body in terms of our
Yes.
balance. So it's really important that maybe they have their doctor review their medications. Maybe that's an issue.
What about people that enjoy alcoholic beverages? Like, because sometimes that.
Sure. I mean, that would totally throw off balance, like, especially when it's incorporated with any type of medications they're on. So it's really important, that statistic that every 19 minutes someone dies from a fall, this is a serious deal. So we really need to be careful.
Okay, and then you mentioned like your vision. If they see vision changes and they're not really able to focus, that's something that they want to get looked at too, right?
They do, sure. And it also goes back to their home environment. They want to make sure they have adequate lighting. If they have stairs or even one step, that they put a bright piece of tape so they
Okay.
can see that step, really analyze their home environment to see, well, my vision's bad, so I need to make sure that this environment is safe for me.
Okay, and all those are really good tips. We have a website that Matt actually has, the startmovingit.com website. You can go there. He has some really great tips. He wants people to get moving, and you don't have to do it in a fancy gym. You can do it in the privacy of your home. And I really thank you for taking time out to be a part of this show. This information is invaluable to most people, and this is something that, like you said, it can start gradual and develop into more and more. Thank you for tuning in. It's such a pleasure to be a part of your life every week. Hope to see you next week on CTN 10.